So first, I'd just like to thank the Focus Ultrasound Foundation for funding the majority of this work. As many of us know in the room, Bowling histotripsy is a mechanical ultrasound technique that uses millisecond-long shockwave-induced heating to produce Bowling bubbles, and the interaction of the bubbles and subsequent waves results in mechanical lysis of the tissue with negligible thermal contributions despite reaching 100 degrees at the focus. And we've been using this technique for a potential future treatment for kidney cancer. As many have touched on in the earlier speakers in this session, HIFU has been shown to induce an adaptive immune response. And these top figures, this is data representing the effects of adaptive immune transfer, demonstrating complete regression of tumor in about 80% of treated mice with prolonged survival. And those were using thermal exposures. And in some series, mechanical HIFU has been shown to be more immunogenic. In this series, with increased TNF alpha expression compared to thermal HIFU. And so because of this, we asked the question, well, what's the immune response to histotripsy as for the most part, a purely mechanical ultrasound technique? And so when we designed our study, obviously the first objective was to evaluate the immune response to Bowling histotripsy in a naturally occurring RCC model, which is the Yucker rat, which has similar biology to human RCC and with sort of similar characteristics of VHL, although the mutation is in the tuberous sclerosis 2 gene. And then subsequently, we wanted to characterize the treatment evolution over time. And so we started off with kind of a brief phase 1 study, treating 16 rats and surviving them up to 48 hours. And then we subsequently developed a longer-term study, which is outlined below, where we essentially randomly assigned rats to either histotripsy treatment or a sham study, and then survived them up to 56 days. And then as another control, we treated wild-type rats just to kind of control for just baseline ultrasound-induced benign tissue injury. I was hoping to focus on this. However, we've been afflicted by very slow-growing tumors compared to the phase 1 study, where all rats had tumors within a year that were large enough. Only 7 of our planned 44 rats had tumors big enough at 1 year. And so to a large extent, I'm going to focus on the 48-hour data. As I mentioned, rats were randomly assigned to either histotripsy or sham procedure when the tumors are 8 millimeter in size. You can see our pulsing parameters there, but in general, we treated with a 1% duty factor with a shock amplitude ranging from 82 to 98 megapascals, and then generally treated about 0.5 cc's of either normal kidney or tumor. And then after treatment, we assessed cytokines with a multiplex assay. We performed IHC to assess infiltrates into the kidney and tumor. And then for the longer-term study, we plan to do flow cytometry. And so for those that haven't seen histotripsy treatment before, there's a characteristic hyperechoic bubbles during treatments indicating that you're targeting correctly and that the treatment's working. And then after treatment, this produces areas of hypoechoicity, which corresponds to the treatment effect. And as we can see on the histology, these tumors display the typical histotripsy effects with a very sharp demarcation between viable. Oops, I was trying to use the laser, sorry. Because there's no laser. Oh, it's separate. That's okay. Oh, I see it right here. Great. No, it's okay. So the yellow arrow indicates the demarcation between viable and homogenized tissue. And when we looked at long-term outcomes, just to kind of show how things look, you can see that over the course of 56 days grossly, that essentially the lower pole and treating this wild-type kidney essentially completely contracts and gets reabsorbed. And it seems like at 14 days in the tumors that we've been able to survive that long, we're starting to see that process with the transition from maximum hypoechogenicity on ultrasound at day 7 to essentially absorption of the hypoechoic cavity, a contraction of the treated tumor with a hint of an indentation on the surface of the tumor at day 14. And so then when looking at immune infiltrates, Again, this is 48-hour data. We saw that there was an increase in CD8 positive T cells infiltrating both the treated tumor and as well as the contralateral kidney compared to the sham. And then when we looked at macrophages, we saw an increased infiltration of M1 macrophages into the treated tumor, but not the contralateral kidney or the sham. And this is a little bit harder to appreciate on these slides because there's some background, but you can kind of see the infiltrate there at the tip of the blue arrow. We did assess some other markers such as CD4 positive T cells and M2 and didn't see any differences there. And then when looking at cytokines, we saw a significantly increased expression of TNF-alpha in the plasma, up to about 24 hours after treatment. And although not significant, likely just due to the small numbers of rats, we saw high increases in plasma HMGB1, IL-10, and IL-6. And then when looking at the renal tissue, we saw significantly increased IL-10 and IL-8 in the treated kidneys, and near significant increases in TNF-alpha and IL-6. And somewhat surprising to us, we actually saw a suppression of interferon gamma compared to shams. And so in summary, bowling histotripsy ablation of RCC in rats produces the desired effects, and it seems that the normal kidney heals within 56 days. In the short term, we witnessed altered cytokine expression and increased infiltration of CD8 positive T cells and M1 macrophages, and clearly completion of our long-term study is needed to further characterize the immune response. Thanks.